Hi, Mike Erlob here, back pain specialist for over 22 years, helping those 30 and older get rid of their back pain issues for good. Today, I'd like to show you how to improve your back pain and flexibility in 48 hours without medical treatment. These techniques work very quickly and effectively, even if you have arthritis, degenerative disc disease, disc bulges or disc herniations, sciatica, spinal stenosis, scoliosis, or even postural dysfunction, just to name a few. You see, those are just labels. Those are not actually the cause of the problem. The root cause of the problem are the imbalances within the muscular system which have placed increased stress on your lower back. So some of these imbalances, they include a hypertonic, meaning the muscles really contracted up, a tight and hypertonic hip flexor or psoas muscle, which is this muscle that comes off the front of the spine, actually hooks in with another muscle here in the front of your pelvis, and it inserts and attaches right here to the front of the thigh bone or the femur. Also, you will have hypertonic piriformis, which is this muscle that actually comes across through the buttock area. And then also quadratus lumborum, which is another muscle which actually attaches along these what we call transverse processes across the top of the hip and up, and then attaches into the ribs. And then you also have significant weakness in through the gluteal muscles, the hamstrings, and the lower abdominals. Now, today we're going to talk about the piriformis and the quadratus lumborum. So the piriformis, as I just mentioned, is this muscle that comes through the buttock area, and this is one of the main causes where you can get sciatica. See, the sciatic nerve, which comes off of the lumbar spine, actually goes either under that muscle, over that muscle, or through that muscle. But that muscle is this thin muscle that lays underneath the gluteal muscles, and it goes right from here across to that femur. And so when it gets tight, it exerts a lot of pull, which then causes a lot of stress into the lower back. Then the quadratus lumborum, which is this square muscle right through here, also can get very, very triggered up. And when that gets triggered up, it becomes extremely painful right in that area. So one of the fastest ways that we can improve this pain and flexibility, and we'll just put our little Johnny right here on the side, is to really work on shutting off the piriformis and the quadratus lumborum. And there are really good ways to do that, but I want to show you how to do that with a foam roller, and then also using either a racquetball or tennis ball. So using a foam roller, and you can pick these foam rollers up really anywhere. You can pick these up at Walmart, Target. They're really very inexpensive, and their uses are just, there's a tremendous amount of uses. You can use them for all different kinds of things. So start off with the foam roller on the floor, and you're going to actually set it right next to you. And then you're going to come up, and the area that we want to hit is, let me show you really quick, is right in the outer glute area. So you do this by starting off with that roller right at the top of the buttocks, okay, right at the top of the glutes. And then what I like to do is I like to put one hand, so I'm supporting, and then the other one just behind on that roller. And then you want to not be directly on it. You don't want to be all the way on your back. You want to be kind of half on, half off. So then from here, what you're going to do is you're going to slowly use your legs to roll right over top of that muscle. Now, when you know you're going to be on it is when you start to get a little bit of discomfort. Now, don't take this to the point of excruciating pain, all right? You should ask yourself when you get to this point, is this pain a little, medium, or a lot? You're shooting for the medium range. So you just kind of roll back and forth. Now you do have a little bony piece that sticks out right here called the greater trochanter. You don't want to be on that, okay? Because that'll surely be painful and actually can create some bursitis and other issues. So you have to be kind of rolled back a little bit so you're going right over that piriformis muscle. Once you get on it, like I said, you're going to know it because you're going to feel some discomfort. Then you just relax and you let your body weight sink over that foam roller, and you hold that for 1 minute. You can either count to 60, or what you can do is just get yourself a timer and time 60 seconds. So once you get to 60 seconds, you just kind of roll off of that, okay? Give it a little bit of rest, and then you can go again. So from here, you're going to roll right over top of that, find that trigger point, go another 60 seconds. All right, you should do this 3 to 4 times. You can go up to 5, but really after that, you shouldn't need to do that any longer than that. Okay, now for some folks, the foam roller may not be enough or may not work as well. In that case, what you can use is you can either use a tennis ball or a racquetball. Now, I'm going to show you a tennis ball. The racquetball is just a little softer. There's a little more give to it, but it's a little smaller. The tennis ball is a little bit more firm. I kind of like the tennis ball for this application, but you're going to do the same thing you did with the foam roller. You're just going to take that and you're going to slide that ball right underneath into your glute area, and then you just roll, and you may have to go on your backhand a little bit, and you just kind of work until you get that tennis ball right over that triggered up hypertonic piriformis muscle. Again, this is a little bit more aggressive, so don't take this to the point of a lot of pain. It should be just a medium level of discomfort. You're going to hold that for 60 seconds or 1 minute, and then you're going to let up. So you just roll off, and then you would repeat that again. Okay? So you're going to do that up to 4 or 5 times. So these would be releases that you do no more than, say, 3 times a week. You don't want to do them every day. You want to spread that out a little bit. Now, the other muscle we talked about was the quadratus lumborum, which was that rectangular square muscle that goes along these parts of the lumbar spine. We call it transverse processes. It comes across the top of the iliac crest or the top of the pelvis, comes up and then attaches to these ribs. So when it gets contracted up, it'll pull your pelvis up, it'll pull your lumbar spine out of alignment. It really causes a lot of pain and discomfort. And that area is right back in here. So one of the best ways to release that, again, is with the foam roller. And what you're going to do here is you're just going to start off with the foam roller at the upper part, okay? So you're going to start more kind of up towards the ribs. Now, you're not going to be directly on it on the side. You're going to be kind of in a half rollover position like I am right here. It really works to either you put your weight on your elbow or your hand, and then you're going to use your legs to help roll yourself up onto that. And you're just going to rock and roll over that until you get to the point where you start to feel some discomfort over that triggered up hypertonic quadratus lumborum muscle. Now, once you get there, little, medium, or a lot, you're looking for the medium level of discomfort. Hold that just like the piriformis for 1 minute. Okay, 60 seconds. After that, kind of come off that roller, let it rest for a few seconds. Do that again. Roll right over top of that, get into that trigger point area, hold the pressure, just let your body relax. Even if you can let your leg relax and just let it fold over that foam roller, giving that medium level of pressure, 60 seconds. And then you would do this for 4 to 5 times. And just like the piriformis, if the foam roller doesn't work as well for you, you can again use a tennis ball or racquetball. Now for the quadratus lumborum, I actually prefer the racquetball. It's a little bit softer, it seems to work a little bit better for me, and a lot of my clients, but I have had a lot of patients who do like the tennis ball as well. So either one is good. And you're going to do the exact same thing. You're just going to take that and you're going to place that in the area of the lower back where that trigger point is. And you're just going to lay on that. And then you're just going to kind of rock until you can move right over that trigger point where the racquetball is putting that pressure, and you're going to hold that for 60 seconds. Now, the tennis ball, like I said, works as well too. You do the exact same thing. Go to that trigger point, and then just give a little bit of pressure. Again, the tennis ball is a little more aggressive. Medium level, 60 seconds. Release, let up. Do that 4 to 5 times. Spread that out, put some days in between it. So like if you're going to do that 3 times a week, you might do it on a Monday, Wednesday, Friday, or you could even do that on like a Tuesday, Thursday, Saturday. But definitely take some time off in between it. Also, it's really a good idea after you do these trigger point or pressure point releases to use some ice over that area. Ice really helps decrease inflammation, helps decrease any tenderness that you might be experiencing. Ice that for about 15 minutes immediately afterwards. It'll really give you a lot of benefit. So there you have it. That is how you can improve back pain and flexibility in 48 hours without medical treatment. If you have any questions, please feel free to contact me at mike@flex-pt.com. That's my email, which is mike@flex-pt.com. And if you got benefit out of this, if you felt that this really helped you, please share this with your family and friends. And until next time, I'll see you soon.